5 o'clock, we are hearing from medical marijuana advocates after Georgia recently legalized the sale of low THC oil here in the state.
On Thursday, 11 Alive learned the state health department's count of medical marijuana patients was greatly overstated, partially because of outdated data from providers. Latasha Gibbons found out this caused dispensaries to overestimate customer demand.
The State Department of Health had been reporting 50,000 people on the low THC oil registry. It turns out there were only about 14,000, meaning the pool of patients in need of treatment was significantly smaller. I talked to dispensary owners who say they prepared for patients who never showed up.
This screams the lack of community engagement.
Lance Robertson, co-owner of CBD City, is responding to the Georgia State Department of Health announcing the number of people listed on the state's low THC oil registry was inaccurate. The previous number released from the state showed around 50,000 patients on the list, when in fact officials say there were only about 14,000. Although seemingly unintentional, some medical marijuana advocates say it seemed like smoke and mirrors when it came to the number of reported people on the registry versus who showed up for care.
We're using the numbers that we get from the state to actually use that to gauge the work that we're doing.
The state says part of the problem has been patients and caregivers not being removed from the registry once treatment was changed or the patient moved or died.
I'm a caregiver. I've never been instructed to make sure that if something happens to my mom, there's a procedure for me to follow.
I'm finding some of the providers are no longer around.
Okay.
You know, some of the patients fall off the list, so we have to figure out how to really set the rules that are realistic.
And we have more details on how the state spotted that miscalculation on our website at 11alive.com.